I'm Dr. Philip Caper. I am accompanied by Alice Knapp. I have spent my career trying to improve the healthcare system that serves the American people. We are here today representing Maine AllCare. Maine AllCare is dedicated to promoting universal, high-quality, and affordable health care for all of the people of Maine. The recently enacted Federal Affordable Care Act is a first step toward reforming the health care system in the United States. It is a step toward health care as a right of all Americans, and it makes tangible improvements in the existing system for many of us. And just speaking personally for a moment, based on my 40 years working on health care reform in Washington and in a number of states, I have tremendous admiration for the people in the administration, the federal administration, and the Congress who are willing to take on this very difficult political problem, third rail of American politics, as it's justifiably called. However, it builds on a broken, unnecessarily expensive, and often cruel system and falls short of its ultimate goals. It will not achieve universal access to health care, nor is it likely to control spiraling medical costs, which are an unsustainable burden on government, business, families, and individuals. Alice?
And I'm Alice Knapp, a little younger than Phil and plugging away on health
You
care
didn't
issues.
have to say that.
I was a health insurance regulator in the state for 11 years and was a regulator during a period of time where we did many of the reforms in Maine that have been achieved nationally now. And I am speaking here on behalf of those who are left out of the Affordable Care Act, which leaves over 100,000 of Maine citizens without access to affordable quality health care. It provides no tangible relief to sole proprietors, individuals, and families with incomes greater than 400% of the federal poverty level. And to put a number to 400% of federal poverty, consider that 400% of the federal poverty level for an individual is a whopping $43,320 a year. At that income level, if you are over 39 years of age, your choice of health plans in Maine's individual market with a premium representing less than 10% of your gross income is limited to Anthem's $10,000 or higher annual deductible plans. And again, at that income level, at 400% of federal poverty, the $43,320, my monthly DearGo Choice premium, which is right now $643 a month for a $2,500 deductible plan, would represent 18% of your income. And just to comment on Trish's 0% rate increase, I was delighted to hear it. Unfortunately, though, I hit what I call the old fart rate tier, so my premium as of October 1st went from $565 to $643. Wasn't zero. For everyone else in Maine who may receive some modest relief under the Affordable Care Act, employment status and wealth will still play a large role in determining access to quality coverage. Multiple health care plans will remain in effect with varying premiums and disparate benefit packages. There will be at least 4 tiers of coverage. This is fundamentally unfair, and this unfairness holds serious health and financial consequences for those left out by the new law and who face serious illnesses.
Many of the problems that Ms. Knapp has described have been solved in most other advanced countries. Taiwan is one of them. We are honored to have with us today Professor William Hsiao. I first met Professor Hsiao when we served together on the faculty of Harvard University many years ago. He is considered one of the world's foremost experts on healthcare economics. He is the principal architect of the universal healthcare system adopted by the government of Taiwan in 1995. He has recently been commissioned by the state of Vermont to recommend changes in their healthcare system to help address issues left unaddressed by the Affordable Care Act.
Welcome, Dr. Hsiao. It's great to have you here.
Thank you, Chairman Creed and members of the Select Committee. Needless to say, I'm honored to be here and come from a state with the highest per capita cost of the healthcare cost, Massachusetts. And nonetheless, I'm here to share some knowledge and experience with you, and then it's up to you, the leaders of Maine, to decide what you would do with that knowledge and the experience I share. I don't want to insult your intelligence by giving you a read what has been distributed to you about a 2-page write-up on Taiwan. I'm just going to highlight some points, and so I can leave a great deal of time for your, I call it the third degree, which I think will be much harder to answer your questions and concerns, but it will help to clarify what are the major issues and what does Taiwan or Vermont may hope for Maine. I'm going to divide my my informal talk into 2 parts. First part, I'm going to just highlight what Taiwan did and what's the impact of the Taiwan's single-payer national health insurance. And then I'm going to talk briefly about what Vermont commissioned me to do, so you can see what your neighboring state plans to do. So let me start with Taiwan first. Taiwan is a country with 23 million people. And when they decided to go for universal health insurance with a single payer administration, Taiwan's income was at $13,000 per person per year. That was in 1995. So at that point, what Taiwan had is many Taiwanese did not have health insurance. So consequently, when they are sick or even when they have an accident, they did not have access to the doctors or to the hospital or to drugs. And this was a social problem that get increasingly more difficult. And the political leadership felt that social unrest or social discontent. At the same time, interestingly, the healthcare cost was rising very rapidly. So on one hand, that people can't afford to get health care. On the other hand, healthcare costs is rising very rapidly, just as you have been discussing 5 minutes ago between Representative Lasso and Oliver. Right? Yes. And so Taiwan was facing many people have no insurance, and so they cannot get adequate access to health care, but meanwhile have very high cost inflation rate. And this is similar to what the United States face today. So by the time Taiwan reached roughly about $13,000 per person per year's income, the political leaders felt it's a time for Taiwan to face up its problem in healthcare. And Taiwan first come to a conclusion: healthcare is a basic necessity for life, for people's well-being. And everyone should have that basic necessity, rather than just leave it to the accident of your life. In terms you are born poor or rich, or you're healthy or you're less healthy. And so that Taiwan decided everyone should have the access to basic health care. When they need to see a doctor, when they need to get the drugs, they need to have the ability to do so. However, healthcare costs money. And regardless how you pay for it, either out of your own pocket or through premiums paid partly by your employer, by yourself, or through taxes, it's going to be paid by somebody through some avenue. So Taiwan's principle is this has to be affordable. They want to give everybody this basic necessity for life, but it has to be affordable and over time is sustainable financially. At the same time, Taiwan acknowledged back in more than 15 years ago, Taiwan's system is broken. So the system is broken. That's the reason why it caused the lack of universal health insurance coverage, as well as the cost is escalating very rapidly. So therefore, Taiwan says, I want to do something fairly dramatic, really overhaul the system, rather than put on Band-Aid solutions on every problem that comes up. Because the system structurally have some problems. So Taiwan decided to appoint somebody to lead the task force. I don't know why I was chosen, but I agreed to lead the task force. I'm a Chinese American. I'm not a Taiwanese. And I did not grow up in Taiwan. I think maybe that's one reason, because I believe this is why Vermont chose me to lead the design reform for Vermont, because I have no vested interest whatsoever in Taiwan. And I don't know people in Taiwan who are the power brokers, who are not the power brokers. My purpose, the charge gave to me, do what's right for the Taiwanese people. For the people. That's your end goal. And that's why I agreed to accept that assignment from the Taiwan's leaders and the government. I started out based on the work on this fundamental principle. I say, let's learn whatever we can from the world. What's done well and what's actually not done well. Let's pick out the best part of what's done well around the world and build on that and avoid their mistakes. I use the word, let's try to leapfrog the world. And if you read some of the papers or ABC News on Taiwan, they trot out Taiwan as really a leading example on how a healthcare system should be built. That's because we follow that principle. Let's learn from others. Now, the question is, for you, the members of the Select Committee, are you willing to learn from others, I would say? And then avoid the mistakes they made, as well as do you want the system reform, or you will continue to put patches or Band-Aids on the problems, each problem that comes up. So what do we recommend then? Taiwan says, I want to have everybody covered as much as you can by comprehensive benefit package. But it has to be affordable and sustainable financially. So learning from the worldwide experience, we recommended that they develop a compulsory universal health insurance.